Social distancing, wearing a mask, and getting a vaccination have become vital to tackling the COVID-19 pandemic. But how has the pandemic affected our children's health and well being? Great questions. We're going to talk about that right now, and it's next. Hi, everyone. I'm Olga Villaverde, and welcome to Dr. Q&A, where prominent doctors and experts answer your questions. And joining us today is Pediatrician Dr. Scarlet Constant with Baptist Health, South Florida. Hi, Dr. Constant. Thank you so much for taking the time to be with us here on Dr. Q&A.
Oh, it's so great to be here. I'm happy to answer any questions that you might have, Olga. Thank you for having me.
And we have lots of questions. So let's get started. We're going to start with COVID-19, if you don't mind, especially the vaccinations. Are drug companies testing their vaccines on children? And do you see families asking you, should I get the vaccine for my child?
Absolutely. Well, to answer the first part of your question, Pfizer has been conducting studies now on children ages 12 and above. And as I'm sure you might have heard, they released last week the results that the COVID vaccine is not only effective, but also safe in ages 12 and up. So now they're moving on to the second part of the studies where they're going to test infants ages 6 months through 11 years of age. And again, they're going to test for efficacy as well as safety. And many parents are, they are asking many questions because they want to know if we advise it and if it's safe for their children. They're very interested and they want to protect their kids the best way that they can.
And I'm going to be completely honest with you. I have teenagers, as you know, and everyone in my family has received the vaccine. I haven't vaccinated the girls. We're talking 16 and 18. So you say go for it.
Absolutely go for it. I think, any ages 16 and above are really like the target age group because they're the ones that are interacting more with each other, whether it's socially or at school. It's just very hard to, seclude them because they do have to go to school and they're going to classes and things are changing. In-person classes will resume. And so their risk factors are so much higher than, let's say, for example, now the elderly population who is mostly vaccinated. So I recommend that you vaccinate your girls just for their safety and your peace of mind, just to know that they're going to be safe. And even if they do get COVID in the future at school, you know that they'll be safe. They won't be hospitalized. Their symptoms would be mild, if not non-existent. And I think there's nothing better than that peace of mind.
Thank you, Dr. Constance. Speaking of school, we have a video question from Kat. So let's take a listen.
My son is still in virtual school. He's been in school all year. And sometimes it feels like we are the only parents that still have our child in virtual school. So what I was interested in knowing more about was, what is the reality of sending your child back if you haven't done it yet? We're sending our son to camp. I'm a little nervous about it, to be honest with you. So we wanted to know the reality, what we should expect, what sort of, how and if COVID is really spreading among younger children, and just kind of an overall understanding of what's happening as it relates to COVID and sending children back.
Thank you, Kat.
That's a great question.
Mm-hmm.
Well, let me start by saying that families like Kat are not alone. I think most families feel that they're the only ones who didn't send their children to school, but that's not true. There are so many other families that have been home since last year, and I know that's very difficult, and I commend them for being able to keep them at home and teach them at home, and that's amazing. But I will say this: they shouldn't worry about going back to school in the fall. What we've seen this year has been remarkable. The safety precautions that have been in place have been excellent. And what's been great is that children have not spread COVID within the schools. The high school level has been a little different. There have been outbreaks here and there. But as far as the lower level schools, middle school and below, the students have definitely been socially distant, and they have not spread COVID within the school, which is great. And so I would say to Kat and her family not to be worried. As long as your child continues to wear a mask and the school has the proper precautions in place, your child would be more than safe to re-enter school. And honestly, children are so adaptable. Even though her child was out of school for a whole year, he or she is going to totally adapt and jump right back in as if time hasn't been missed at all.
Oh, I can see all the happy faces and teachers and everyone saying, welcome back. It's going to be amazing to see. We have
Yes.
many questions. I do want to remind our viewers that if you do have a question, please send them in. It's so easy to do. Check it out right here. Question for the experts. All you have to do is email us questions at allhealthtv.com or just give us a call, 855-796-4475. Don't forget our website, allhealthtv.com. Doctor, we just talked about Kat's concern about her son going back to camp and school. I have another video question from Sarah that's a little bit similar as well. Let's take a look.
Hi, Dr. Constant. My name is Sarah. I am a first-time mom with a 16-month-old starting daycare in June. And since she's not quite 2 yet, she won't be wearing a mask. So I'm curious if there are other safety protocols you think we should keep in mind for her age group. And do you suggest we practice wearing a mask before age 2?
Thank you, Sarah, very much. Dr. Constant?
Great question. With going back to daycare, it's a good question because the daycares have been really great about keeping the actual facility nice and clean, limiting the amount of students per class, and really exercising precaution, even though the kids are not required to wear a mask below the age of 2. I think that the best advice I could give Sarah is to make sure that the school or daycare that she does choose will continue to put these restrictions in place, meaning less children in the classroom. Hopefully the daycare is not going to have 20 to 25 students in a room with one teacher. So if we could keep the rooms with a low population and the teachers are continuing to wear masks and washing their hands in between caring for the children, then she should be safe. Another good question to ask, honestly, and it's a fair question to ask, is if her particular teacher will be vaccinated. Because if her teacher will be vaccinated and have the same, what we call cohort of students, then the safety measures go up dramatically. It would be wonderful. And she would not have to worry about her daughter not wearing a mask. I say if you want to practice wearing a mask, that's great for the little ones, but it is very difficult and it's totally understandable if they don't. But more importantly, if the teacher's vaccinated and wearing a mask and continues to wash his or her hands before interacting with the other children or changing diapers, etc., then I think that her daughter will be just fine in daycare.
That's a great point, and I'm really glad you brought it up, Dr. Constant. Okay, we're going to shift now to traveling. So a lot of parents who have been vaccinated, like me and you, hopefully want to start traveling or doing something over, the summer, the holidays, months to come. What suggestions do you have to keep them safe?
Yes. So that's great because, this is a very unique situation in that we feel much more safe because we've been vaccinated and we can obviously participate in more activities that we haven't participated in over the past year. However, the caveat is for a parent like me that has young children, my children are not vaccinated and will not be vaccinated for a very long time. So I have to take into account that I need to protect them and keep them safe. So with travels, of course, we want to continue wearing masks. We want to travel to places that are not that don't have high positivity rates, for example, and participate in activities during our travels where we won't be in high population areas. For example, my kids and I are not going on trips where we're going to dine indoors or be in a very high populated area, go to museums and things like that. However, another family that has older children, and let's say the entire family is vaccinated, you have the liberty to participate in a few more high risk activities that maybe I wouldn't. So I would say that parents need to take into account what the situation is in your particular family, who's vaccinated, who isn't, and where are you going? Are you going on a camping trip or out to, a very remote area, or are you going to a high density population area where you'll have constant interaction with large volumes of people? Those are things to consider on your trip. But overall, traveling is back on the table. And I think that families should really enjoy their time off this summer and enjoy their family.
It's so nice to hear you say that. Just want to remind our viewers, send in your questions. We'd love to hear from you. Here's how you do it. You want to ask the experts a concern you may have, just email your question to questions@allhealthtv.com. Give us a call. That's another option, 855-796-4475. And don't forget our website, allhealthtv.com. Okay, doctor. So due to school closures over the past year, let's be honest, children staying home, children doing less movement. You know exactly where I'm going.
Yes,
Have
I
you
do.
seen kids gaining weight, becoming lazier, parents concerned?
Yes, all of the above. I have seen dramatic weight gain in the younger kids. I mean, some patients are unrecognizable, which I understand there is decreased movement. Absolutely. There was a time where kids and parents were afraid to even go outside in their own neighborhood. So there was decrease in activity. And the other thing which was very unique, and I saw this with my own children, is that when they were home, virtually learning, they wanted a snack, I would say probably every 15 to 20 minutes. And I don't know if it was nerves or just sitting there in front of the computer, but the kids were snacking, I mean, double or triple as much as they would on any other regular day, because at school you don't get to snack this often. So there was consumption of increased calories and absolutely decreased activity levels. And so I have encouraged all of my patients to please get out there, exercise, get out with the family, go on a walk, go on a run. There's no reason to stay sedentary inside of the house.
And any suggestions as we watch this beautiful family be active outside, which we really should, even in the backyard, throw a football, play kickball,
Right.
whatever the case may be. And it could be in your own environment, which is safe as well. Any ideas on a diet? How do we stop that little snacking going on? Because it's true, they're just sitting there and it's grab this, grab that. And the next thing you know, it's added calories that are truly unnecessary.
Truly unnecessary. Well, I encourage designated snack times. You know, there's nothing more important than having a schedule. And when you don't have a schedule, that's when you're free to do whatever you want at any moment. I think sometimes they don't even realize that they had a snack a half an hour
Mm-hmm.
prior. So if you're still home, then these are the times that you can have your snacks and nothing outside of that. And you know, it's hard. I know it's hard. Not everybody is home with their kid or watching them like a hawk, but if it's possible to monitor your children, you have to monitor their intake. There are designated times to eat, and anything outside of that is just not permissible. And then when you do have your designated snack times, they have to be healthy, high protein snacks. You can have fruits, apples with peanut butter, avocado, good fat, good protein that's going to hold you so you don't feel the need to get that little sugar kick or the sugar rush.
Absolutely. You're making me hungry right now. So we talked about vaccines at the top of the show. There's a lot of myths. There's a lot of conspiracy theories. So I'm just going to, just be point blank with you and ask you this. Are you hearing from parents, teenagers that are concerned that the vaccine could change their DNA? Have you heard that?
Yes, many parents have asked me if it will actually change your DNA, and the answer to that is no. That is not how mRNA works. It is literally just a messenger. It is sent in to do one job and to create one protein, and that's it. And that would be the spike protein on the COVID virus. So it goes in to do that, and once that job is done and it creates that protein, it dissolves and it is no longer there. So absolutely not. It will not change our innate DNA.
And I'm glad you mentioned the word messenger RNA. We've heard so much about that in the last year. And we actually have a short video that explains from the Mayo Clinic. Take a look.
We've got two really effective vaccines from Pfizer and Moderna. These vaccines are about 95% effective at preventing COVID disease. So these vaccines work by delivering some of this mRNA into our cells. The SARS-CoV-2 virus got a genetic code of its own. There's a little segment, a tiny little snippet of that actually codes for this spike protein. The spike protein is the thing that helps this virus get into our cells and infect us. mRNA is like a little recipe for how to make that spike protein. When we get these vaccines, our body makes that spike protein and we develop an immune defense to it without ever having to be exposed to the whole virus. It's not exposing us to the whole virus at all, live or killed. It's only allowing us to make a little bit of that spike protein, which is just a tiny portion of the virus, and then we react to that and become protected from the whole virus. mRNA in these vaccines can only get into the main part of the cell, but it can't get into the nucleus of the cell, which is where our own DNA lives. And it can't incorporate into our DNA. And it also doesn't live very long. It doesn't last very long. It's very fragile, and that's why it has to be stored at these ultra cold temperatures. It's not stable for very long. So it goes into the body, goes into the cell for a matter of hours and starts to make this protein. Then in the coming days, our bodies react to that protein, but that messenger RNA doesn't hang around, nor does it get into our DNA.
A lot to unpack there, Doctor. Help us also maybe in just a few sound bites and in layman terms, how just the vaccines help build immunity as well. And I remember when I got mine, they told me give it about a couple weeks before you really know that it's done its duty, let's say.
Right. Right. So what the video was trying to show was that the messenger RNA goes in and creates the spike protein that is on the surface of the COVID antigen. And what happens is when you have that protein, our body will recognize it and see it as a foreign entity and create antibodies to attack it. So that's great because this is what your body normally does when it's introduced to a virus or a bacteria or an illness. And so instead of having to get the actual virus, you can have kind of this false, I'd say, reaction where you create this protein without actually having the virus, and then your body creates antibodies to attack it. Once those antibodies are created, we keep them in our body's memory. So in the event that we are actually exposed to the true virus, our antibodies have already been created and they come back again and they try to fight and break up that protein. So we will always have immunity.
All right. And one concern that I have from a parent, and I got no name here, but I do have the question, can the COVID-19 vaccine affect fertility in the future? And that is obviously the concern of maybe a teenage daughter receiving the vaccine and having that problem when she wants to become a mother. Have you heard that question from your patients?
Yes, I've heard that question quite a bit, and I wasn't sure really what the genesis was of the question because we've all received many vaccines and there's never been a vaccine to affect fertility. I'm not sure if it's the fact that it is an mRNA vaccine that causes the concern, but again, because the mRNA does not live long and does not affect our DNA, there is no way to affect your fertility. So they should not be worried about that.
Good. I'm glad we covered that. Okay. So during the pandemic, I'm just wondering about this as well. I wonder how many parents did not take the children in or their child to get vaccinated. Have you seen a lower number of kids keeping up to date with their vaccinations?
We did. It happened probably 6 months ago or so, before 6 months, but now everybody's back. They're totally catching up. Everybody's coming into the office and trying to be up to date with the vaccines and physical forms. So thank goodness everybody is really doing a great job in trying to maintain immunity and maintain good preventative health.
Fantastic. We have a few more questions from our viewers, but I do just want to remind anyone who's just tuning in right now, if you have a question for our expert, it's very easy. All you have to do is email us questions@allhealthtv.com. That's why it's Dr. Q&A. And our phone number, 855-796-4475. And of course, you can always check out our website, and that's allhealthtv.com. Doctor, we have another video question from Daniela. That happens to be my daughter's name. Let's see what her question is. Let's take a listen.
Hi, yes, I am the mother of a 2.5-year-old daughter who is very close with me as far as attachment, especially through this entire pandemic. She will be starting school in the fall, and one of my biggest concerns is just a heightened separation anxiety that may come from or as a result of the pandemic, and any long-term effects that this will have on her just overall anxiety and or fear from being away from me.
Great question.
It is really a great question. And it has been a tough time because, to be honest, a lot of children have been with their parents 24 hours a day, and they're not used to being left with a babysitter or going to school. And so there is a bit of separation anxiety involved, absolutely. And my advice to Daniela is right now to start preparing her daughter. And what I mean by that is, introducing her to her bedroom and letting her play in there for a little bit and having kind of her time alone in her room, just so she knows that that's her safe place, and she can be left there and not need to go look for her mom. So encouraging individual or independent play at home is the first step. And then little by little, showing her the school and reading books to her about going to big girl school or daycare, and just showing her that the separation is normal, and just preparing her for the steps that are coming in the future. The best way really with children is to always prepare them and be open with them and transparent with the events that are going to take place. So she will be fine with the separation. It will be difficult initially, but if she prepares her slowly over time and talks to her and allows her to see that independent play or independent activity is totally fine and mom will always rejoin you, that's usually the best way to handle it.
Fantastic. Thank you, Daniela. I have a question here, and this one I find to be interesting, and I'm sure this has happened a lot in your office. What should I do if my child has symptoms of coronavirus? I mean, let's not forget that children do get sick, children do get colds, children cough,
Yes.
but now you just hear,
Right.
oh, and people go, corona. So what do you do? Because the fear is so great.
It is. And this is what we're going through right now. I mean, on a daily basis. When the children do have your upper respiratory symptoms, such as a cough, runny nose, or cold, usually what we do is we screen the parents on the phone first, and we ask a couple preliminary questions. And if the risk of them or the likelihood of them having COVID is low, we have them come in and we're happy to examine the kids right away in the office. We really don't want to encourage families to go get tested at the sign of the very first symptom. The idea is to wait for symptoms to progress and let your physician see you first and examine you. And if all else is ruled out and maybe COVID is still on the table, or there was some type of exposure, or there is a suspicion that perhaps the child was exposed, absolutely we recommend testing. But remember, it's very odd for a family who doesn't have any symptoms at all, and let's say both parents work at home, the child doesn't go to school, to just have COVID, an isolated incident of COVID. Those situations are less likely. So we really assess the situation, we ask a detailed history, and then we go from there.
I have another question from a parent who has a college student, and this is actually my scenario as well. If my child, which is now an adult, got COVID in college, should she get the vaccine? And I can say the same for my daughter, Samantha. She got COVID. And I also want to follow up with one doctor that I'm just going to throw in too, if you don't mind. Do you think it would be beneficial if children, again, college students, get the vaccine, and it's mandated in some colleges or all colleges?
Yes. So as far as having COVID in the past, that, the protection that you have or the antibodies that you created from having COVID have been proven to last about, they're saying 60 to 90 days, but its efficacy is pretty much unknown. So you are not protected from getting COVID again if you have actually had COVID. And I know that's counterintuitive when I explain the mechanism of the vaccine, but what happens with vaccines, it's almost like a super response. So while you did create antibodies by getting the actual virus, those antibodies were created and the efficacy wanes down and goes away over time. Whereas with a vaccine, it's almost like a super response. So you're able to create a better response more antibodies and more effective, and that lasts much longer. And we still don't know yet how long the vaccine is effective, but we know for sure at least 6 months for right now until the studies are done again. And so what I'm saying with that is that you should definitely get vaccinated to protect yourself from getting COVID again. And I think it would be great if universities mandated vaccines, because young adults are congregating all the time and their lifestyle is not going to change at the university level. So to protect our kids, our young adults, we should absolutely have them all vaccinated.
Fantastic. We actually have time for one more question. I know the question,
Okay.
and I think this is adorable, so I'm going to take it. It's a 180 from what we're talking about, and this is Sierra.
Okay.
Take a listen.
Okay.
What would be your recommendations for parents attempting to transition their children into their own bedroom?
Oh, we got about 60 seconds, Dr. Constant, but let's not forget Sierra.
Okay. So transition to their own bedroom. Help them, go with them, decorate the bedroom with them, let them choose it and make it their own. Children love autonomy. So this is the big girl or big boy room. Let them enjoy it. Have them spend time in there during the day, maybe even take naps sometimes. That way it's their own and they feel safe there. And they have to understand that when it's bedtime, this is where they're going to sleep. You explain that you're right down the hall or around the corner. You'll always be there. If they need anything, they can come into your room, but this is your room. This is where you sleep and where you belong. And you can just do that with extinction, meaning you just constantly bring them to their room and let them play in there, let them spend time in there, and make them understand that this is where they're going to sleep. And they might not like it the first few days, but they absolutely get used to it over time and they will stay. After about a week, they'll love it and they'll stay in their room.
Dr.
Or bed,
Constant,
their
it's
own
always
bed.
such a joy having you. Thank you so much for your time. We always appreciate it.
You're welcome. Thank you so much. This was great. Good to see you, Olga.
Be safe, and we'll see you again on Dr. Q&A for sure. And thank you so much for joining us. I'm Olga Villaverde, and we'll see you next time. You take care.